Imagine, for a moment, that a fire breaks out in your home. And in this reality, 911 doesn't exist. You might call the fire department directly, but they're not equipped to come to your location and only put out fires at the fire station. And the only people that will come to you in the community are the police, who, though well-intentioned, are meant to provide a very different type of public service. This lack of a fire-specific response seems ridiculous, right? Of course we should have targeted services to respond to life-threatening emergencies, whether that's fire, law enforcement, or physical health. However, in many communities across America, life-threatening mental health and substance use crises are treated as an afterthought, receiving a response that's not specific to their unique needs. A 911 call dispatches the police, who most often bring the patient to a medical emergency room or jail, or allow them to remain in the community but without assessment, treatment, or support. We have a patchwork system, made up of elements designed for other purposes, that doesn't have the capacity to treat the most vulnerable in our communities, even though an estimated 20,000 to 25,000 individuals in crisis go to emergency departments every day in the US. So how can we improve? The only solution to delivering crisis care worthy of our communities is to build a structure specifically for mental health, substance use, and suicidal crisis that is on par with other emergency systems, like we do for medical, fire, and law enforcement. By integrating 3 core elements, we can replace the patchwork fabric of our crisis care and develop a true safety net that can serve everyone, everywhere, every time. And in the process, we can reallocate wasted financial resources to places where they can have a deep community impact. It starts with regional or statewide crisis call hubs, call, text, and chat lines staffed by trained professionals who answer the call every time and direct people to the level of care they need. The onset of 988 is a great start. However, it will need to be supported by technology that empowers 988 to become an air traffic control for mental health and substance use crisis, enabling real-time coordination across the care spectrum. But a comprehensive crisis network cannot be built with only crisis call hubs. Additional services are necessary to ensure that a unified system of care is available when and how people need it. Services like mobile crisis outreach teams, 24/7 non-law enforcement mobile teams that go out in the community and deliver care to people wherever they are. This lessens the burden on law enforcement during situations where they're not needed and eliminates the anxiety people feel when a uniformed officer knocks on their door. And facility-based crisis receiving and short-term stabilization, facilities that say yes to every person that walks through the door, regardless of their level of need, allowing them to bypass the medical emergency departments. This not only provides specialized care to these individuals with less waiting, it also enables medical emergency departments to focus on the patients they're trained to serve, while drastically reducing wall time for police when transportation by police is warranted. With these core elements in place, mental and substance use healthcare can move out of the shadows and into the mainstream. Together, we can build an unbroken system of care that connects patients from the point of crisis to the level of care that's right for them. To learn more, visit crisisnow.com.